It's very natural for us to avoid things that make us feel unwell. But avoiding the things that make us anxious can lead to even more anxiety in the long run. And it could prevent us from doing the things we want to do in our lives. When these patterns of behavior and thinking get stuck, and we're creating scenarios that bring us worry, we could talk about an anxiety reaction. There are many ways to treat anxiety, and I use counseling in my practice. Anxiety has very typical physical, psychological, and behavioral symptoms. A symptom is something you feel, think, or a way of behaving that is outside of normal, when fear and worry plague us and prevent us from living the lives we want to be living. Understanding anxiety is the first step in getting help or helping somebody else. In the body, we feel anxiety as a fast heart rate, tight chest, or pain. Sometimes we'll feel sweaty hands or palms, and sometimes we'll get chills or overheat. Often there's a clenching of the muscles in the jaw, in the hips, or feel stomach pain or sickness. Anxiety is a function of the parasympathetic nervous system. It's our body's way of preparing to respond to danger. It's our fight, flight, or freeze response, or sometimes known as the stress response. It's when we understand something is dangerous and our body is preparing to react appropriately. Because our body is so ready to deal with danger, it can overreact when we perceive danger through our belief system or what we think might happen, but is not actually happening. Our bodies are designed to protect us when we encounter threat, like a wild animal when we're hiking, but the stress response overreacts when we perceive a danger that's not actual. While our bodies have developed this ability to be ready for trouble over millennia, our minds are a little newer to the scene, and we get in trouble when our body overreacts to what our mind is doing. Now, this could be worries about friends, grades, work, sickness. The important thing is these things are usually not happening in the present, but we're thinking about them in the future. When we're experiencing pain in the chest, when we're feeling sick in our stomach, we want to move away from the experiences that are doing that to us. So it's very natural for us to avoid things that bring us anxiety. Now, there are many things we could do to work on anxiety in our lives, like changes in lifestyle. We could eat better, sleep more, exercise more. Breathing and relaxation. Mindfulness is being shown to be a very powerful tool against anxiety. Or we could work on the negative thoughts themselves, challenging them, or even paradoxically learning to accept them. Over time, using all these techniques, we can gradually desensitize ourselves to the anxiety-provoking situations so that we could do the things we love in life. Now, it might seem strange, but the functional aspect of anxiety for me is like asking, what's anxiety trying to show us, trying to teach us? I believe that anxiety sometimes is trying to get us to pay attention to some part of our lives that we're not paying attention to. We could talk about our woundings, we could talk about unlived aspects of ourselves or our lives, or disconnection and loss. All of us have had negative experiences in life. Injury, embarrassment, shame. Some of us have even experienced trauma, sometimes at the hands of somebody we know, care about, or trust. Returning to these experiences can be very painful. Sometimes we need to address them in order to heal. And that's why anxiety is a normal accompaniment to some counseling and to any healing practice. I believe that all of us are very whole, and we carry a multitude of ways of expression and capacities that we don't actualize, that we don't use in day-to-day. Learning to get in touch with parts of ourselves that we don't know yet can be very exciting. I think about people who have explored their sexuality in new ways through counseling, or developed relationships with family members that they never thought possible. These freedoms of excitement and hope are wonderful. However, sometimes going about expressing these parts of ourselves to others can be scary. Learning to feel this freedom and authenticity sometimes takes vulnerability. We need to be vulnerable to the people around us, and sometimes that comes with anxiety. But with some work, a whole integrated feeling of self can replace the fear. Lastly, anxiety can be asking us to take a look at loss and disconnection in our lives, putting us on a path to reconnection and acceptance. Loss can be to our natural environment, loss of connection to our culture, to others, even to meaningful work. Taking chances and being vulnerable are important hallmarks of a fulfilled life. I believe that through counseling, anxiety can be a powerful teacher and be transformed into courage, vulnerability, and empowerment on a road to a happier and more full life. My name is Kouri. You can reach me at my website, www.scottkouri.com.